Hello, Dumelang everyone, and welcome to another edition of the Sports Health Corner, where we answer your sports medical questions. If you missed the last 4 shows, you'll remember that in the first one we were introducing how the show is going to run, and in the second one we spoke about pre-sport medical screening, and the third one, Doc, if you remember, we're talking about concussion or head injuries, and the previous one that's just ended, we were talking about sudden cardiac arrest. And if you missed those, just go to our Facebook page, go to our YouTube page. When you get there, like the Facebook page and also subscribe on our YouTube channel. As usual, I'm with our resident doctor, Dr. Thulani Ngwenya, and today we're talking shoulder injuries, Doc.
Yeah.
Doc, in every sport, it doesn't matter which sport you're playing, whether be it darts, javelin, rugby, cricket, tennis, you need a good shoulder to actually perform that sport. First of all, welcome to the show for today. And Doc, what is a shoulder injury?
Yeah, thank you very much, Shlooks, for welcoming me. And it's always good and a pleasure to be part of your show. And the feedback that we've been getting is quite good, that it's quite informative. And I like the fact that you have actually bred me from talking medical jargon and try and talk to the people. And that's the whole idea, to get to the people and for the people to understand.
Absolutely.
Yeah. Now, when talking about shoulder injury, now we are talking specifically about shoulder. Remember in the first show we discussed about an injury being an impact or something that is a force that is being applied, external force applied to any body and causing harm to that particular part of the body. Hence it's called injury. But this time around we are talking about the shoulder. So it's any force being applied that will cause harm to the shoulder. Now, but with shoulder, most of the patients they present with pain, and but we'll get to that, because now you can't discuss an injury without discussing the approach to it.
Doc, I hear there are different kind of shoulder pains or injuries,
yes.
that are available. What are the common types? What are the common ones?
Yeah, when you look at the shoulder, you need to know the anatomy first. So
it goes back to the story of the anatomy.
Yes. So if you look at the shoulder, you start with the bones that are in the shoulder. So you know that you've got this big bone called the humerus, and the humerus is then being joined by the clavicle and the acromion. So those 3 bones then forms as well as the shoulder blade. So all these bones, they form a shoulder. So now, apart from the bones, then there's muscles there, and then there's some tendons there. So inside there's also nerves that runs through the shoulder. There's also arteries and veins that runs through the shoulder. So with an injury is actually categorized according to those. So any injury to any of those structures, then it's called a shoulder injury. That is why shoulder pain can be any of those. I forgot to mention the nerves. So it can be any of those. For instance, with the bones, you can have dislocation. So with dislocation, it can be an anterior dislocation or a posterior dislocation. But what we see commonly is anterior dislocation, where you are hit from behind and your shoulder dislocates anteriorly. But you can still have a posterior dislocation.
And it's excruciating pain.
Well, it is excruciating pain, but when the adrenaline is up, you actually don't really feel the pain. That is why you can actually reduce it there and there. And then the athlete can go. So that's
what happens when you get that dislocation.
Yes.
You're actually able to move it back because of the adrenaline.
Yes, because of the adrenaline. Because when the adrenaline has taken over, then the pain in a way is suppressed. So that is why you are actually able to deal with it. So we are talking about dislocation. You can also have a fracture, a break of the bone. So breaking of the bone is called a fracture in medical terms. So that's also an injury. So common injuries of fractures that we get in the shoulder is when your long bone is broken, the humerus is broken. But sometimes you can have clavicle that is actually broken. So those are the 2 common breaks that you get. Now, over and above the bone now, we go to the muscles. There's quite a lot of muscles around the shoulder. We've got the deltoid, but I won't discuss more. But there's an important group of muscles called the rotator cuff muscles. The rotator cuff muscle, there's 4 different types of muscle. Those are the muscles that really help you with the action of the shoulder, whether it goes backwards, forwards, up and down,
sideways,
inside. So those are there's 4 main muscles. Well, just to name it, the supraspinatus, infraspinatus, subscapularis, and teres minor. I won't talk more about the medical jargon, but the gist of it is for one to know that there's 4 group of muscles that are called rotator cuff muscles that plays a major role in terms of the movement of the. So any injury also to that, you can actually associate it with the shoulder injury.
So Doc, having said what you've just said now, how then do you approach a shoulder injury? Because then it must be a bit difficult not knowing which part of the shoulder is injured or painful.
Yeah, well, in terms of the approach, like we've mentioned in our first episode, approach remains the same. Firstly, when the patient comes in, you must look at their posture. Posture is how the physical appearance. So someone will come in holding like that. Someone will come in strapped already. So already it gives you an idea. But when you are taking history, which is the first and important part, they will tell you that they've got shoulder pain. And now when they tell you that they've got shoulder pain, then you want to understand more about the pain. When did this pain happen? How did the mechanism of the injury, how did it happen? Were you kicked? Were you pulled? Did you fall?
Were you just swimming?
Or were you swimming and then you started feeling this pain? So it is important to understand also the mechanism. Now, going into the pain, you need to understand to say, in terms of severity of the pain, out of 10, is it 9 or 8? What makes this pain worse? What relieves the pain? So do you take medication for the pain? What makes it better? So now the pain, is it worse when you are sleeping and resting, or is it worse when you are doing activity? Because most of the shoulder pains, they become worse when you are actually relaxing and resting. That is why you'll find most people with shoulder injuries, they'll tell you that when we are active, we don't feel anything. But when we are home, this thing is very, very, very painful, because it becomes worse when you are now relaxed. Remember, we spoke about adrenaline.
Yes.
So the approach is to get history, and then once you have history, it will then direct you. History directs you that when you are doing the examination, then you are focused, because it could, we've spoken about a lot of structures in the shoulder. So when you have history, then it will tell you, the pain is mostly towards the muscle. So maybe my focus should be more towards examining the muscles. Then you'll because now there's also a lot of muscles that you'll be dealing with.
Yes.
So you also now, when you do the clinical examination, you have to rule out, is it the infraspinatus? There's a special test that you do for infraspinatus, but bedside. Is it the supraspinatus? There's a special test that you do to rule that out. Is it teres minor? You need to do a special test. Is it subscapularis? There's a special test that you do. So with this special test, then you rule out some of these muscles.
Yes.
Then it focuses you on what could be the problem. So then that helps you in terms of management, because at least now you've got an idea that this is the muscles this is the actual muscle that most likely will be dealing with. In medicine, there's nothing definitive when you're doing clinical examination. That is why you've got your differentials, that it could be this muscle, it could be this, it could be that. That is why you then have to do a radiological investigation to confirm your clinical diagnosis. But then the approach then becomes different now when you deal elite and weekend warriors.
Before we get to that, you spoke about the history.
Yeah.
How important is the history, and how does it, you said it actually directs you as to where to go. Then what are you looking for when you talk about the history?
Yeah, remember they are talking about pain. They come to you to say, Doc, I've got shoulder pain. Now, shoulder pain, it could be any of these structures. So when you are taking history, for instance, you would ask them, did you feel a break or a click? Then you know that if they didn't feel such, most likely, and they are not deformed, there's no obvious deformity, then you know most likely it's not a fracture, you know. So at least then it takes you away from a fracture, a possible fracture. And together when you look with the mechanism of action, how the injury occurred. Now, if they tell you that they were doing their swimming practices and they started feeling this pain, then you would know with swimming and the action of swimming, most likely there's an impingement of the nerve because of this repetitive movement when you are actually doing swimming. So with that history, it directs you. Now you have to do bedside examination that will have to rule out impingement. But if it is positive for impingement, then you know that when you do investigation, you focused on something that will pick up impingement.
And in terms of history, I've often heard some people say, in summertime I never feel pain, but when it comes winter time, my pain flares up.
Yeah.
What would be the challenge? Because sometimes they talk about the knees or the elbows, but in this particular case, we're talking shoulder.
Yeah. When you have such, most of the time is joint. It has to do with the joints. Shoulder joint, knee joint, finger joint, wrist joint. So that happens most of the time with people that are suffering from arthritis. That is why most of the time people who say such are people mostly that are elderly and that most of the time are diagnosed of arthritis, or people who have had an operation before, but now because they've had operation, because they are going to winter, then they feel the pain is coming back because there has been interference with the normal body functioning because of the operation. So yeah.
Now, Doc, I'm a weekend warrior, and I come to you present my challenge that I've got this shoulder injury. Do you treat me the same as you would an elite athlete?
Yeah, the approach is the same, but the difference becomes where we need to do a radiological investigation to confirm. Now, a weekend warrior will talk to say, we will need to do, for instance, just an example, an MRI. Do you have about 8,000, 9,000, 10,000, 12,000 to do an MRI? It's just an investigation, mind you. It does not treat you.
Is that how much it costs?
Yes. That's how much it costs. I'm not exaggerating. It's in the range of 8 to 12 for a shoulder, sometimes even more. So we discussed to say, can you afford that? Can we actually go? Because that is not treatment, by the way. It is an investigation to confirm what I'm actually suspecting. So if you do have, then we'll take you for an MRI. But for an elite athlete, for instance, a swimmer, you need to get them ready for the Olympics. So that one is compulsory because you can't treat blindly. Yes, you've got some differentials to say it could be this, but you need something definitive to know whether you need to go straight for operation or you can treat without operation. So it helps you and guides you in terms of how then do we treat and how much time do we have for them to get back to competing again. So for elite athletes, most of the time, we'll go the route of doing an investigation and confirming what the problem and confirming and diagnosing. That is a diagnosis. We have to have a diagnosis before we treat. So a clinical diagnosis, it could be, you can actually go wrong, but most of the time with experience, you are most of the time right, but you can go wrong because it is not confirming, it is giving you an idea. But with elite athletes, then that is why we have to do it, and then once we have confirmed what it is, then we treat. But for a weekend warrior, then we decide, do you go for an MRI or not? And if you say no, then we have to treat based on the clinical examination. And mind you, that's when now we have to talk to say, we are treating based on what I've picked up. Mm-hmm. I could be wrong because we have not confirmed anything. So it is very important for you to discuss that with the patient, that we have not confirmed anything because we haven't done any radiological investigation. But we'll treat based on what you have picked up. Now, when you are treating, then we'll have to see if there's any improvement. If there's improvement, that means you are doing the right thing. If there's no improvement, then you have to reevaluate your diagnosis and look at maybe it could be something else. That is why you had differential diagnosis, then you'll go to the next one. We are suspecting that is supraspinatus, but because they are not improving with the management that we are giving, then let's go to infraspinatus. So you need to monitor your patient in terms of improvement.
And Doc, does the severity of shoulder injury differ from sport to sport? I mean, a wrestler, for instance, or a darts player, or a cricketer. The severity of the injury, does it differ from sport to sport?
The type of injury of the shoulder, yes, differs from sport to sport because it depends on the action. For instance, a bowler cannot really have the same problem as a scrum half. Or no, maybe I'm saying it wrong. But the person that does scrum,
yeah,
the person that does scrum in rugby, because of the impact, So it's different. It's different in terms of the injury. So with a swimmer, because of the action, then they might have the same as a fast bowler. So it is because now a fast bowler, because of the action, always doing that action. Sometimes it gets your because of your shoulder joint rubbing, or the group of muscle, rotator cuff muscle, rubbing against the acromion. It gets inflamed. The inflammation process then, because of the inflammation in that small compartment, it then increases pressure. So if there's increased pressure, then because now structures are inflamed, they start then compressing the nerve, and then that is called impingement. So for a rugby athlete, you can get an impingement because if there's inflammation, most likely there could be an impingement. But you most likely most of the time an impingement is secondary to overuse injury, when you have used that structure over and over and over again, and then it gets inflamed, then you find an impingement. So for the other type of injury, the muscles that we have spoken about, it could be a strain. For instance, in cricket, you might have overstrained when you're bowling, and then you strain one of your rotator cuff muscles, and then maybe it tears, or it strains. So that injury is different. But you'll need to understand when you're doing the clinical examination, you'll need to rule out in terms of which muscle it is.
You mentioned earlier that the shoulder can be very complicated.
Yeah.
And you mentioned the nerves. That sometimes you could have a challenge with your shoulder, which could affect either your elbow or your wrist or your fingers.
Yeah, well, in terms of, there's a big nerve group called an axillary nerve in the shoulder that supplies the whole upper limb. So if you've got compression of that nerve, one of the things that could happen is that you'll feel pins and needles. You'll start feeling weakness of the hand. You will start having compromised blood supply even to the lower parts. So it affects any part of the upper limb. So that is why it is very, very important to take proper history. All those things in terms of whether you have pins and needles, whether you've got weakness of the hand, you pick that up when you are doing the history, because it directs you. Because then when you have pins and needles and stuff, then you know that whatever you are dealing with, it's also associated with the nerve.
And are there ever any complications when dealing with shoulder injury?
With all injuries, there's always complications. For instance, if the nerve breaks because of a fracture, for instance, say you go in head on with another person, you are playing what's this football that American football, and then you go shoulder to shoulder, and then you break one of the bones, and that bone goes in and cuts that nerve. Then it tells you that you need surgery, and surgery, it might go right, it might not go right. So that's one of the complications of a shoulder injury. But there are many. You can have a bone fracture and then when they are doing reconstruction and through healing, you don't heal properly, and there's malunion and stuff. And if you are not being followed up, and you are one of these enthusiastic athletes that wants to go back before time, and you feel better, and then you find that you actually not healing well, there's malunion. And when there's malunion in a long time, in a long term, then it gives you other complications. So there's quite a lot. It is structural. You need to understand the anatomy of that. So anything that is within the anatomy of the shoulder can go wrong.
For a person like a goalkeeper, they need their shoulders because they dive a lot.
Yeah.
Now, if you look at the shoulders in sport in general, do they need special training for a shoulder to make sure that it stays forever intact?
Yeah, when you are doing the sporting codes that requires more of you to use the shoulder, you'll need to be conditioned for that. So there's conditioning training that bulks up your muscles so that you've got good muscle strength for that. Even for swimmers, like for instance, we've been making an example of swimmers, they've got exercises that help them to bulk up their shoulders such that their shoulders are good and they are ready for such a requirement, because that demand is not the same as a person that is not swimming, and that demand is over and above what a normal person would require. So they'll need special training for that. It goes with all different parts of the body. For instance, for when dealing with the lower limb muscles, you need to bulk up your thighs and quads so that they are ready for that particular requirement or demand that comes, the physical demand that comes with playing that particular sport. So with all the joints, with all the muscles, they will require, that is why we've got conditioning trainers and physical trainers for different sporting codes focusing on the demands of that particular sport.
When you're looking from a distance, Doc, a shoulder looks like something small, but upon further inspection, you realize that actually plays a big role. Has it ever ended careers?
Yes, of course. Shoulder is not small. It's a big joint, a shoulder. And over and above that, it has a lot of structures around it. So, like I said, imagine having that nerve being completely cut from a fracture. It will need an op, and there are not guarantees. There are no guarantees that you can actually come back. So any complication can lead to a career-ending injury. It's like, for instance, I'm going to make emphasis with swimming, because swimming is the most common one that uses the shoulder. So with swimming, and if you've got a shoulder that has got weaknesses, unfortunately, you can't swim that fast because you need your hands to actually do the action for you to be able to compete at the highest level. That is why if you have got a shoulder injury, it's a big setback for swimmers.
Oh, well, Doc, thank you very much. That's all the time we have for this episode. Join us next week when we again tackle another topic on the Sports Health Corner, where we answer all your sporting questions. Remember, go to our Facebook page, like the page, go to our YouTube channel, and subscribe. Tell your friends all about it. And remember, we at the Sports Health Corner, we answer all your sports medical questions. And don't forget, this is my show, this is your show, this is our show. Stay safe, stay injury free. I'm Matlhomola Morake, and I'm out.